Have you ever experienced that familiar burning sensation, the constant urge to go, or discomfort that signals a bladder infection? It is frustrating, inconvenient, and sometimes even painful. Now imagine that happening not just once, but over and over again. When these infections keep coming back, it can feel like a never-ending cycle. For repeated bladder infections, the clear answer is yes. You absolutely should consider seeing a specialist. While your primary care doctor is excellent for initial treatments, a specialist can delve deeper into the root cause of these recurring issues. The reason a specialist becomes so important is that repeated infections often point to an underlying factor that might be missed during routine visits. A specialist, typically a urologist, possesses advanced training in the urinary system. They can perform more comprehensive diagnostic tests to pinpoint issues like structural abnormalities, kidney involvement, or even different types of bacteria that requiring specific treatments. They understand the intricate mechanisms of bladder health for beyond general practice. Deciding when to see a specialist usually comes after 2 or more infections within a 6-month period, or 3 or more in 1 year. First, discuss your symptoms and history with your primary care doctor, who can then provide a referral. When you see the specialist, be prepared to share your detailed history of infections, including specific symptoms, previous treatments, and how often they occur. The specialist might recommend tests such as a urine culture with sensitivity, bladder ultrasound, or cystoscopy to examine the bladder's interior. One insightful detail a specialist can offer is identifying whether your recurring infections are truly bacterial or if they might be mimicking other conditions. They can also explore postcoital prophylaxis, which involves taking a low-dose antibiotic after intercourse to prevent infection, if that is a trigger for you. Understanding these specific triggers and conditions allows for a much more targeted and effective long-term prevention strategy. Ultimately, consulting a specialist for repeated bladder infections is a proactive step toward achieving lasting relief and maintaining optimal bladder health. Their expertise helps you move beyond just treating symptoms to understanding and resolving the underlying causes, ensuring a healthier and more comfortable future.